position that we chose to address was obstetric fistula in undeveloped countries. Our proposition is the UN should fund training for non-physicians to perform C-sections to prevent obstetric fistula. Here we have a little example from somebody. I do not have friends because of my sickness. They wouldn't sit by me because I was smell. My only companions were my children. They would not go near anyone because I was ashamed of my smell, of me. So there's our proposition. We're going to go over, is there a need for change? Yes. Obstetric fistulas used to be prevalent in the United States and Europe, but when C-sections became commonplace and we had better obstetric care, they stopped happening pretty much. So, yes, there is room for improvement. Prevention is possible. So, is the need the fault of the present system? Right now, there is a shortage of doctors and other non-physician trained personnel to take care of these sort of situations, and we have obstructed birth. Does the plan solve the problem? Our plan is prevention in the form of training non-physicians to perform C-sections and more comprehensive prenatal care. Practicality, feasibility, workability, and advantages. We're going to prove that there's cost-effective, achievable training programs that are able to help the patients as well as educate the midwives. Okay, so the Fistula Foundation defines an obstetric fistula as a hole between the woman's vagina and one or more of her internal organs. The hole develops over time in obstructive labor, which you can see right here, where the head of the baby is pressed either towards the front of the bladder or back here towards the rectum, and that cuts off blood supply to the tissue. When the dead tissue falls away, there's a hole left behind. And then the example here, number 2, is a vesicovaginal fistula between the bladder and the vagina, and back here is a rectovaginal fistula between the rectum and the vagina. So the hole can cause permanent incontinence of urine and feces, or both. A large number of women suffering from fistulas are abandoned by their husbands in the community because of their smell. It's very bad for their self-esteem. Some of the causes are the low status of women and girls. They don't have very much value or worth in their communities, so it's not seen as a big problem or something to be addressed. There also is the poverty that leads to malnutrition, and when you are malnourished, it can lead to a condition called stunting that makes the skeleton unable to fully mature. Therefore, your hips don't grow wide enough in order to pass a child. It contributes to obstructive labor, which is the main physical cause of fistulas. Here are some statistics. We had a couple of different varying numbers from the World Health Organization and the Fistula Foundation. The numbers go between 1 and 2 million women suffer with fistula in the world, with anywhere from 50,000 to 180,000 new cases each year. Most of these sufferers reside in sub-Saharan Africa and Southeast Asia, but fistulas can occur in any underdeveloped country. 50% of all births worldwide have complications, but fewer than 6 in 10 women in developing countries have an attending physician or trained professional present during childbirth. So when these complications occur, there's no one there to be able to help them. That often leads to injuries and even death. So at about 90% of obstructed birth, the child also dies, which is further traumatization to a woman who is suffering from really bad internal injuries already. So fistulas are treatable, and more importantly, they are preventable. So I'm going to head this over to Nargis to discuss our stock issue 2.
Okay, so there are lots of hospitals full of girls that are waiting for their names to be called out. But there are so few doctors in those hospitals that they have to wait for such a long time with their fistulas, and people just can't stand by them. If non-physicians would be taught to perform those kind of C-sections, there would be help for the doctor, and also the patients wouldn't have to wait for such a long time. Obstetric fistulas are easily prevented by C-sections. But again, there isn't enough doctors in the hospitals to perform those kind of operations. Some of the examples are, in Mozambique there are 17 million people, but they have only 3 surgeons to perform those kinds of surgeries. In Nigeria, the population is 11 million people, and they have only 6 surgeons. And in Nigeria, which is the most populous country in Africa, 137 million people, they only have 8 repair centers, and that's still not enough. Back in 2002, 3 hospitals ran out of space for those girls. There are 40,000 maternal deaths occurring each year, which represents 10% of the annual maternal deaths around the world, according to the UN. Northern part of Nigeria reports lower rates of contraceptive use, antenatal care, and assisted deliveries than any other regions of the country, resulting in more maternal deaths. 53 doctors and 405 nurses were trained in fistula repair surgery, with only 2 surgeons that reached the advanced trainer level. More than 386 healthcare workers have been trained in family planning counseling and methods in obstetric care. In 2011, significant progress was made to scale up treatment, and more than 7,000 fistula surgeries were directly supported by the UN, a 40% increase, which is a 40% increase from back in 2010. However, hundreds of thousands of women and girls worldwide still wait for treatment, and global treatment capacities are severely deficient in reaching and healing them all. The campaign to end fistula, which was launched in 2003 and was led by UN, it has expanded over the years and currently involves 64 global partner agencies, including Direct Relief International and the Fistula Foundation. The campaign addresses all aspects of obstetric fistula, which is preventing it, the treatment, the social reintegration, and also psychological obstacles that these girls have. The long-term goal for this foundation is to make fistula as rare as possible in underdeveloping countries. In spite of the progress achieved in capacity building and provision of treatment and care for fistula survivors, there are still lots of gaps, like not enough doctors, not enough nurses, not enough equipment, not enough space. Fistula takes a long process, taking up lots of space and doctor's attention, so before getting the fistula, we need to be able to prevent it. Fistula Foundation treats obstetric fistulas. Funding from generous donors allow them to provide their partners in the field with human and financial resources that enable as many women as possible to receive the treatment they need. Every site funded is coordinated and staffed by local nurses, heroic doctors, and care workers who understand the community and understand how to provide the best care possible to the women they treat. This foundation helped more than 20 countries in Asia and also Africa. A major obstacle to providing fistula treatment throughout the world is the lack of suitability trained surgeons. Obstetric labor in the developed world is nowadays routinely taken care of in the most cases before a fistula can form, by preventing it with C-section. Training local healthcare workers is a key solution in fighting fistula in Africa and Southern Asia, where the condition is most prevalent. Not only does the training local surgeons help to overcome immediate need, it can also be a culturally appropriate and long-term sustainable solution. To help overcome this challenge, the Foundation has partnered with the International Federation of Gynecology and Obstetrics to offer the world's first fistula surgery training fellowship, which is a 6 to 8 week program offered as accredited training centers for Africa. So they started doing this, but there isn't lots of foundations who do it, so they need help. The fellowship provides training and mentoring oversight to candidates from countries mostly weak who intend to return home with this training to continue to serve their communities. But once they get into that field, most of the nurses that are being trained, they just become afraid of it and they lose it. So sometimes the key to increasing treatment is the prevention of equipped facilities. Sometimes the key is the education. Teaching fistula sufferers what fistula is and letting them know where they can go for pre-treatment. Sometimes the key is paying for the transportation. Sometimes the solution is simply finding surgeon salaries or supplies. But whatever the solution is, we need to overcome the problem. And now Roxanne will talk about the plan